Hello, my name is Aino Kohtala. I'm a clinical psychologist and a PhD student at the University of Jyväskylä. I'm here to discuss a recently published article that I wrote together with my thesis supervisor, Professor Raimo Lappalainen, and our third co-author, Joona Muotka. I'm going to talk about the brief intervention that we did and its results and their relevance and applications. Our aim was to figure out whether we could produce and achieve long-lasting results using a really brief intervention protocol with inexperienced student therapists with really limited training. The intervention model was semi-structured, consisting of 4 individual sessions. The model was based on ACT methods with emphasis on values and committed actions. The student therapists were master's level psychology students with very limited training to psychotherapeutic methods and ACT methods specifically. The training consisted of 10 hours of general training on ACT and then 4 additional hours specifically to train the intervention model and protocol. The student therapists also underwent weekly group supervision sessions to ensure adherence to ACT methods, and the supervision was also meant to plan subsequent sessions with the supervisor. I'm going to show you a few pictures to demonstrate our main results regarding depression and psychological flexibility. The first one shows the number and percentages of participants in each depression severity category at different points of the study. At the 5-year follow-up point, almost 60% of the participants at that measurement reported minimal to no depressive symptoms. This graph shows the result regarding depressive symptoms. As you can see, there's a significant decrease in depressive symptoms, both from pre to post, but also there were significant changes after the treatment period. Of course, that may be due to, for example, spontaneous remission or the actual intervention, or both. We don't know that. The main thing I would like to point out from this picture is that the depression scores did not bounce back to the pre-treatment level. Of course, the number of participants is significantly lower at this 5-year follow-up, but still the results are promising. Here are the results regarding psychological flexibility. There was a significant pre to post as well as post to 5-year follow-up change in psychological flexibility. The level of flexibility was maintained and even some increases were found in it after the intervention ended. All in all, these results indicate that good outcomes were maintained and there were even some improvements in the well-being of the participants after the intervention period ended. As the results regarding this brief intervention and its 5-year follow-up were really promising, we would like to bring forward a few points, a few applications and relevance of the results. Firstly, I would like to point out that the student therapists that administered the brief intervention were inexperienced and they went through a really time-limited training. Yet the intervention and the student therapists were able to produce long-lasting effects. And we believe that offering these type of structured evidence-based interventions could offer a viable possibility of offering psychological help in the lower levels of the healthcare system. And in those settings, the staff is often not highly educated and trained in psychotherapeutic methods, and experienced psychotherapists are not available. Yet psychological help should be provided for mild and subclinical symptoms to prevent them from worsening. So we believe that these type of lighter and briefer interventions could be a really good possibility in those type of places. And this model could be offered as a first step of providing psychological help easily, quickly, and this model could be implemented to those settings, and the training of the staff could be done rather quickly. And we suggest that this brief intervention model could be offered as some sort of an open doors policy, so that the person could just walk in without any referrals or diagnosis to get effective help quickly. Even though this acceptance and values-based intervention was studied among participants suffering from low mood or depressive symptoms, the focal point of the intervention was not depression. It was values and values-based actions and the barriers that arise when people are trying to live a valued life. So the aim of this intervention was to teach skills on how to be more flexible and open and accepting towards one's feelings and emotions that are regarded as aversive or distressing, while pursuing a life and while behaving according to one's values. This type of principle-based model seems to be more flexible and more easily modified to suit various needs and various psychological issues and even health-related issues. And we believe that this type of approach that promotes psychological flexibility is able to produce long-lasting results, because it teaches skills on how to handle the thoughts and emotions that may rise up when people encounter adversities in life. And our results actually support this, as the long-lasting effects were found and the good outcomes were maintained. So thank you for listening, and if you have any questions or perhaps you want the intervention protocol, feel free to contact me through email.